10:30 on your clock.
Thank you, Bonnie. Hello, everybody. Good morning. Thank you all for being here. We appreciate it very much, and a special thank you to our speakers today, who are Dr. Bruce Scott, the President of the Kentucky Medical Association, Carrie Schelling, Executive Director of the Kentucky School Boards Association, Dr. Rob Smith, Superintendent of Bellevue Independent Schools, and two Graves County High School seniors, Kendall Tubbs and Abby Stratton. According to the latest Kentucky data, more than 1 in 4 Kentucky 12th graders used e-cigarettes in 2018, and 1 in 7 middle schoolers used e-cigs, or vapes as the industry likes to call them, in that same year. But they're not just harmless water vapor. E-cigs are chock full of nicotine and poisons that are addicting and sickening our kids. So let's call them what they are: tobacco products, and let's keep them away from our kids. That was one of the primary goals of the Tobacco-Free Schools bill we fought so hard for this past legislative session. And thanks to the leadership of Representative Kim Moser and Senator Ralph Alvarado, we won an important battle for our kids' health. Now it's time to implement that law, which requires Kentucky school districts to post signage indicating that the entire campus and all school vehicles are 100% tobacco-free 100% of the time. The law says that schools' tobacco-free policies must go into effect by the 2020-2021 school year. It provided, however, no funding for that signage. I know everybody's shocked by that. The Foundation for a Healthy Kentucky, the Kentucky Medical Association, and its Foundation for Medical Care are about to remedy that. Today we are announcing the Tobacco Free for Students program, under which we are partnering to pay for and to ship free tobacco-free campus and vehicle signage to Kentucky public schools, the school districts all across the state. Every public school district that goes newly tobacco-free after April 9th, 2019, the day the bill was signed into law, is eligible for this free signage. The program includes both metal signs for use outside, as well as window stickers for external building doors and school buses. We will provide the signage on a first-come, first-served basis. All school districts have to do is pass the policy, fill out an order form, and send it in. Now, we want every Kentucky school district to be 100% tobacco-free, and we know that placing readily recognizable tobacco-free signs on campuses across this state will remind students, staff, and entire communities that tobacco use has no place, anytime, or anywhere at school. So, we have designed the program to provide an incentive for schools to adopt their new tobacco-free policies quickly. Starting in January 2020, we will expand eligibility for the free signage offer to include those districts that already have adopted tobacco-free policies before the new law passed. So, school districts that want to be sure they get first dibs at this free signage should pass their tobacco-free policies by the end of the year and get those order forms in. The Tobacco-Free Schools Law and the signs you see here today are about improving health in Kentucky. They're about changing the norms around tobacco so that today's kids don't see it being used everywhere they look. They're about making schools a safe haven from the signs and smells of smoking, vaping, and dip. And now I'd like to introduce Dr. Bruce Scott. He's going to talk a little bit about why reducing kids' exposure to e-cigarettes and other tobacco products is so important to their health. Bruce and the KMA have been tremendous partners of ours, and this is something, smoking, of course, and the use of tobacco products is something that the KMA has been fighting, I don't know how long, Bruce, but probably since you all came into existence, a very long time. Anyway, we very much appreciate your all's support and help.
Thank you very much. So good morning. As you heard, I'm Dr. Bruce Scott. I am the president of the Kentucky Medical Association. It's an honor to be here to represent the medical community and the KMA members. Tobacco cessation has been an important item on our agenda for many years, but we're really honored now to enter this partnership with the Foundation for Healthy Kentucky to try to help the youth of Kentucky never start smoking in the first place. We've had a previous program to commit to quit, to try to get Kentucky adult smokers to quit, but now we're going to take it to the next generation. As physicians, we see every day the impact of tobacco on our patients. I'm a head and neck surgeon, and I see patients with sinusitis, children with ear diseases from secondhand smoke, and yes, continuing to see laryngeal voice box cancer in a high rate in our patients. Tobacco remains the most preventable cause of death and disability in the United States. I want to thank the sponsors. Along with what Ben said, I want to thank the sponsors, Senator Ralph Alvarado and Representative Kim Moser, for House Bill 11, the bill that resulted in the smoke-free school law that ultimately is allowing us to hopefully get all Kentucky school districts to be smoke-free. You heard that 1 in 4 Kentucky teenagers in high school are using either e-cigarettes or tobacco products. And actually, many educators say that the rates are actually even higher than that. Right now in Kentucky, adults are smoking at a rate of double the national average. It's estimated that today there are 119,000 teenagers who will ultimately die prematurely because of smoking. That's not something we can stand by and allow. We have heard that there is a surge in the use of e-cigarettes and vaping. In fact, the state substance abuse prevention program found that e-cigarettes and vaping use among teenagers doubled between 2016 and 2018. The products are designed to appear like a flash drive, so they're easy to conceal. They're easy for the students to hide. They don't produce the typical cigarette stench and smoke that the principals and teachers were able to detect in the past. They come in flavors that are oftentimes compelling to our youth. Do you think that unicorn vomit and cotton candy are designed to get a 45-year-old to stop smoking, or to get a teenager to start smoking in the first place? The secret is done. Nicotine is a highly addictive product. Nicotine impacts your mood. It impairs your judgment. It impairs your learning. These are the last things we need our teenagers in Kentucky schools to have available to them. We are creating, and Kentucky is facing, a new generation of nicotine addicts. When you consider the fact that 90% of adult smokers started smoking before age 18, we have an imperative to make sure that we stop smoking and convince every high school student never to pick up a cigarette or a tobacco product in the first place. Kentucky has languished at the bottom of a number of health statistics for a number of years, and it's time for us to step beyond that. So I'd like to present a challenge to today's youth, to our high school students today. Let you become the generation that stops tobacco use in Kentucky. We won't become the next generation of tobacco addicts. We will be the generation that stops this addiction. Thank you for the opportunity to be here to talk about this important issue.
Well, if you all were in any doubt about the harms of tobacco, there you have it. We understand that it is the chief cause of our health problems in Kentucky, the chief preventable cause, and that's why we're so concerned about it and why we're trying to do what we're doing. The foundation, and I think I can speak for the KMA on this, are tremendously grateful to the Kentucky School Boards Association for helping advise us on the tobacco-free for students signage, the distribution program, and frankly for being a really key cog in helping get this bill passed. I think it's very safe to say that without the help of the Kentucky School Boards Association, Carrie and Eric Kennedy, I don't think we could have gotten this done. They were just incredibly important to this. The KSBA has also been monitoring Kentucky school district adoption of tobacco-free policies, and we've got Carrie Schelling here, and she has some exciting news to share. Carrie.
The Kentucky School Boards Association is honored to partner with the Foundation for a Healthy Kentucky, the Kentucky Foundation for Medical Care, and the Kentucky Medical Association on this very important school signage initiative. At a time when state funding for public education is extremely limited, partnerships like this are critical in easing the burden on local communities and stretching precious resources. We are so grateful for not only their investment of funds, but their respective investments of time and energy to make this happen and see it through. KSBA supports statewide measures that help our public schools become 100% tobacco-free because it's important to our members and it's important to their students and their employees' well-being. Even prior to House Bill 11 being signed into law earlier this year, 72 of our locally elected school boards adopted their own 100% tobacco-free policies, thanks in large part to the efforts of the Foundation for a Healthy Kentucky. Since the bill signage into law, though, that number has grown. We are now at 129 public school districts and counting. These signs send a very clear message about district commitment to tobacco-free policies. And perhaps equally important, they convey what is possible when grassroots advocacy, local governance, and state legislation work in tandem on behalf of students. KSBA is committed to facing the youth vaping epidemic head-on, and a tobacco-free future for all our students seems more possible now, thanks to the dedication and the generosity of the groups represented in this room. Thank you so much.
Thank you, Carrie. So, if anybody had any doubts about whether this law was successful or not, whether this law was a victory or not, let's put that to rest right now. We've gone from 72 school districts to 129 that are tobacco-free. That, ladies and gentlemen, is a big deal. And we're very, very excited about that. And I don't believe we're going to stop there. Ultimately, our goal is to get every one of them to be tobacco-free. These maps that we have here illustrate what has happened. The map on your left is a shot of the school districts before the law was passed, and a map on your right is a shot of the school districts after the law was passed, the dark blue being those that have gone tobacco-free. So, we're very, very pleased with the progress that has been made, and we hope that school districts throughout the state will continue to jump on board. Next, we'll hear from a school superintendent from Northern Kentucky who was very supportive of the statewide tobacco-free schools law, or a tobacco-free schools law, Superintendent Rob Smith of Bellevue Independent Schools. And then following Dr. Smith's remarks, our two Graves County High School students have some thoughts they want to share. Rob?
Hello, I'm Rob Smith from Bellevue Independent, and I am happy to report that the number 129 to my right will soon be 130. We are in our first reading in the month of August at our board session, so hopefully in the next couple of months we will have that passed. And I didn't want to wait until January because I know those signs are hot about it. This issue was important to me from the beginning, as I spoke about it at our conference back in the spring, but it really got a shot of urgency this summer. I was on vacation with my family and with my two high school age children. We were at a professional baseball game out of town, and at the game in front of us sat a group of 4 or 5 young men who looked to be of late high school, early college age. And I watched them pass a vape back and forth, and how easily they could conceal the smoke from when they would exhale. And I thought, if they can do this in this environment with little to no detection, it's certainly going on in our schools. And that really gave me a shot of urgency that led me to this point today. And will a sign prevent a student from making that decision? No. But I think it sends a strong message that the adults around them care, and they want to prevent them from going down this path. If you know anything about Bellevue, we are a small school district in northern Kentucky. We are less than a square mile. We have about 600 families. And what we like to say is that we don't enroll students, we enroll families. So I think this sign and this policy, passing this policy, sends a message to both our kids and our families that this is important. We care about them as well. And if this can spur an adult to make a healthy decision, then it's even better. So I'm proud to be here and proud that our school board has decided to make this decision. And again, we will hopefully by September meeting, we will be a number and an additional shade on this map, and so we're happy to be here. So I'd like to thank the Foundation for a Healthy Kentucky and Kentucky Medical Association, along with the sponsors, Representative Moser, who is actually in the Northern Kentucky area, and Senator Alvarado. So appreciate it. Thanks for being here.
Kendall and Abby, please come on up. These are two young people from Graves County, Kentucky, in the far western part of our state.
Hello and good morning. My name is Abby Stratton, and I'm one of the tobacco-free advocates for Western Kentucky. First of all, I want to start off by thanking the Foundation for a Healthy Kentucky, the Kentucky School Board Association, and especially the Kentucky Medical Association for taking the initiative of paying for signage for tobacco-free campuses. This gives schools not only the incentive to become tobacco-free, but also increases the number of schools willing to become tobacco-free. Throughout the course of my high school career, I've seen the increase in tobacco use among teens. I've seen the increase for the need of tobacco-free schools each year. As a cheerleader, I travel all over my region for both football and basketball games, and I notice that most schools are already tobacco-free. I notice the difference in their campus and mine. The elimination of secondhand smoke, a better environment for asthma patients, and a better atmosphere are things I desire for my school. And lucky for me, my school recently just became tobacco-free. I want to thank my school board for this, for allowing this, and now I know change takes time, but I most definitely anticipate a positive change in my school in the years to come. Thank you.
Hello, my name is Kendall Tubbs, and like Abby, I'm a tobacco-free advocate and a senior at Graves County High School. I'd like to thank the Kentucky School Board Association, the Kentucky Medical Association, and the Foundation for a Healthier Kentucky for all that you do, for allowing us to come here and convene today, and for allowing us, the students, to speak on behalf of our experiences and how we are working to fundamentally shape our schools and change norms around tobacco use. Coming from Mayfield, a small rural town in western Kentucky, tobacco has been ingrained in our culture. And I take it as far as to say that the usage has become a social norm. The prevalence of signage, not just in our high school, but our middle school and our elementary schools, would set a new standard. It shows students, especially young students, that the usage of tobacco is not normalized. And it helps to educate our community that we have a tobacco-free campus. All in all, this year I'm finishing my high school career, and I have seen the use of tobacco go from being cases of addiction among students to a school-wide epidemic, meaning that it is of utmost importance to focus on informing all levels of education, from 1st grade to 12th grade, on tobacco use through signage and policy, because I'm sure we can all agree that the easiest way a smoker can quit is to have never started in the first place. Thank you. Also, so after August the 9th, our school actually signed on to be a part of this. And we'd like to color in our county.
Abby, step back just a little bit. There you go.
We'll make that a little darker blue soon. But that's wonderful news. I'll tell you, thank you guys. Listening to you all, I think, makes everybody realize that maybe we might be in decent shape after all in the future here in Kentucky. Thank you all for being who you are and standing for what you stand for. We're happy to take questions from anybody now, and if you guys would come on up, those who have spoken, come on up, and we'll just see if anybody's got any questions. And if they don't, we'll get a nice group picture.
I do want to say that we've already received our very first order for signage.
Apparently, is it Bracken County?
It's Bracken
County. County's already Johnny on the spot and sent their order in this morning.
Squeeze in just a little bit more, everyone. Any questions?
Any questions?
So I know that one thing that was brought up when this bill was making its way through is how exactly this applies to, say, football games and other activities that take place on school campuses. Will it be enforced to parents out in parking lots and football games and things like that?
Anybody want to take that on?
Well, if I may introduce our Director of Policy, Katrina Kinman. She is sort of our local expert on all things policy. Katrina, do you mind? I know you've had many discussions with districts.
The policies.
You need to come up to that.
Oh, okay.
You don't mind. Thank you so much.
Thank you. We drafted the policies based on the language in the bill, and it states that employees shall enforce the policy. And it's on all property contracted by the board, owned by the board, leased by the board. So yes, it would apply to football stadiums and enforcing the policies there.
Parking lots and all
As
that.
part of our pregame ritual, we will be reading a statement that basically points people in the right direction. If that's the choice they're going to make, these are the designated areas outside of our campus that you're welcome to do so.
And one of the reasons that the signs were done the way that they were done was so that employees or others who might want to see the law enforced could point to the signs and avoid confrontation. They also are the language on them is very friendly and not blaming anybody. It's just a notice to everybody that this is a tobacco-free campus and you might want to comply.
It's not just about eliminating the secondhand smoke, it's also about the example. I mean, what example is an adult setting for the youth when they're doing something that is recognized as being harmful for your health? So we want to eliminate that bad example. I mean, particularly in a place like a school or school activity where it should be all about promoting health and well-being and education, not about bad habits.
And setting good examples.
Good examples.
Yeah.
What I'd like to see as an example is students from all around the state coloring in their county. That would be an image that I'd like the news media to capture in the counties.
Yeah, it's great.
We have spoken also with superintendents who told us that the signage helps make the law self-enforcing. We also, you'll notice on the order form that's in your media kit, there's a small card that's announced, and it's a, perhaps you didn't know we've changed our policy, and it's a non-confrontational way to just hand someone a card and easily share the new policy with them without being confrontational. And we have been told by superintendents in various districts that already had tobacco-free policies that that was a very effective way of helping people understand the new policy. It will take time, but it's about changing norms. Any other questions?
Pretty self-explanatory, huh? All right, thank you all very much. Appreciate you being here.
We're here for one-on-ones if you